Hello, guys. My name is Lucy Ora, and I'll be talking to you guys about. Well, I'm going to give you a little bit of education about the topic, but then I just want to know what you think about it. Would you try it? Would you want your relative to try it? What would be your advice if someone were to ask you if they should do it or not? And what we're talking about is in vitro fertilization. Or is it? No, egg freezing. Egg freezing. So, I was talking with my friend about egg freezing, and he was trying to understand how exactly the process works. I knew I had an idea it was similar to in vitro fertilization, but he wanted to know how the egg was going to be frozen. Like, is it going to be taken out of your body? So, well, I decided to Google it. So, just a quick one. So I found that it's human oocyte cryopreservation, however that is pronounced, egg freezing, is a process in which a woman's eggs are extracted, frozen, and stored. Wow. Like saved for later. Okay, it goes on to say that later when she is ready to become pregnant, the eggs can be thawed, like defrosted, like when you bring out food from the oven, from the freezer, like when you bring out your rice, your meat, your chicken, your stew that is blocked, okay, water, from the freezer, then you leave it out to thaw. So when she's ready to get pregnant, the eggs can be thawed, fertilized, and transferred to the uterus as embryos. What's the purpose of this? They say it is aimed at 3 particular groups of women: those diagnosed with cancer who have not yet begun chemotherapy or radiotherapy, those undergoing treatment with assisted reproductive technologies who do not consider embryo freezing an option, and those who would like to preserve their future ability to have children, like either because they do not yet have a partner, like you don't have a husband, you don't have a boyfriend, whatever, someone you want to have kids with, or for other personal or medical reasons. Okay, so now we have an idea what that is. Let's see what the method is. The egg retrieval process for egg freezing, is the same as that for IVF, in vitro fertilization. This includes one of several weeks of hormone injections that stimulate ovaries to ripen multiple eggs. When the eggs are mature, final maturation induction is performed, preferably by using a GnRH agonist rather than human chorionic gonadotrophin HCG, since it decreases the risk of ovarian hyperstimulation syndrome, with no evidence of a difference in live birth rate. The eggs are subsequently removed from the body by transvaginal egg retrieval. The procedure is usually conducted under sedation, and the eggs are immediately frozen. The egg is the largest cell in the human body and contains a high amount of water. When the egg is frozen, the ice crystals that form can destroy the integrity of the cell. To prevent this, interesting, the egg must be dehydrated prior to freezing. Really? This is done by using cryoprotectants which replace most of the water within the cell and inhibit the formation of ice crystals. Okay. Success rates. The percentage of transferred cycles is lower in frozen cycles compared with fresh cycles, like approximately 30% and 50%. Quite comparable, they say. And this costs between 5,000 and 8,000. Like, hey, I'm a Nigerian. I know some of you watching are Nigerian. I don't mean 5k naira. I don't mean 8,000 naira. Between $5,000 and $8,000. How much would that be? Quite a lot of money. Might not be for something which will, like a process which will preserve your eggs, so that much later you don't have to like be scared like, oh, when I'm going to get married, when I want to have kids, and I'm ready to have kids, and I'm much older, I won't be able to have kids. With this process, they say you won't have to worry about that. So they say it reduces pressure on women. So like you're kind of like rest assured that, oh, my egg is frozen, it's waiting for me, it's okay, everything is good. So when I'm ready, you get it thawed and the process is concluded, and boom, there you have your baby. Okay. So the cost of egg freezing costs between $5,000 and $8,000. This does not include This does not include the fertility medications, which can cost between $4,000 and $5,000. So we're talking about $10,000. $10,000. Egg storage can vary from $100 to several $100 or more per year. Oh, I forgot, you have to pay for freezing your eggs. Of course you have to pay. When you deposit a body at the mortuary, don't you pay? You pay. How about an egg? Hey, you're gonna use to have kids. Oh, you will pay. You go pay now. You go pay. So you have an idea what it is now, and quite clear, so I know what to tell my friend. But you tell me, would you freeze your eggs? Like, if the company you're working with suggests that to you, like, oh, don't have any kids now, don't have any babies now, just freeze your eggs so you can concentrate on work, would you do it? Apart from your company, like if you haven't found a husband, like especially in Africa, and most especially in Nigeria, from my experience, ladies are always like in a hurry, like, hey, I want to marry, I want to have my kids before I go old, I want to have my kids, because when I'm 30 years, I won't be able to have kids again, and I'm 35 years, I won't be able to have kids again. I'm getting old, and with this, they say you wouldn't have to worry about all of that. So would you try it? Is it something you would try? Is this something you try? Would you freeze your egg so you could use it at a later